Good afternoon and welcome to the Committee on Higher Education. Today is March 31st, last day before April Fool's Day. It's 3 p.m. We're in room 229 and the meeting is being streamed live on YouTube, and we'll cover all of our nominees and GMs in the Higher Education Committee. The testifiers will be limited to 2 minutes. If there are temporary glitches during your turn to testify via Zoom, we may have to move on to the next person due to time constraints. We appreciate your understanding and remind you that the committee has your written testimony. I will be reading from a list of individuals who've submitted written testimony for each measure, and I apologize in advance if the closed captioning does not accurately transcribe your names. If you're interested in reviewing the written testimony, please go to the legislature's website. You'll find a link on the status page. In the unlikely event that we have to abruptly end this hearing due to technical difficulties, the committee will convene on Tuesday, April 5th, 3 p.m. in this room 229, and a public notice will be posted on the legislature's website. If you've been to our meetings and you've heard these announcements and you're tired of it, can you imagine how it is for us who have to read it before every meeting? We keep asking it to be a recording, but we haven't gotten that yet. Introduce my committee members. I'm Senator Donna Mercado Kim, chair of the committee. My vice chair is Senator Michelle Kidani, and to my left is Senator Gil Keith Agaran and Senator Kurt Favela. And with that, I want to thank all the nominees in advance for your willingness to serve and coming forward. We certainly appreciate that. So with that, I would like to get started. We will start with the first item on the agenda, which is GM 588, and this is submitting for consideration and confirmation to the Hawai'i Medical Education Council gubernatorial nominee Colleen Inoue for a term to expire 6/30/2025. And just a little background for our viewers, the Hawai'i Medical Education Council, HMEC, they analyze the state healthcare workforce for the present and future, focusing in particular on states' needs for physicians, assesses the state's healthcare training programs, recommend to the legislature and UH Board of Regents ways in which healthcare training programs can improve and change in order to effectively meet the HMEC assignment. It monitors and continue to improve the funding plan. It seeks funding to implement the plan on the county, state, and federal government. So with that, we do have our first testifier is Jerry Hedges from the University of Hawaii in support. Jerry? Jairus, rather. How are you?
Senator Kim. I'm fine, and I want to speak on behalf of Colleen Inoue. She has been representing us from County of Maui, and she has been a practitioner who understands some of the medical workforce needs on neighbor islands, and has been doing a great job. We'd sure like to see her continue her efforts with the task force that we have on Hawaii Medical Education Council. So our recommendations are strongly to continue her participation. Now, she may not have been able to get on for this hearing because she has been traveling and is on the East Coast at a medical meeting and is about to fly back. So I'm not sure if she's on as well, but we do speak in favor.
Well, thank you for saying that. Jairus, I appreciate your testimony. So anyone else wishing to testify on behalf of this nominee on Zoom or in person in our room? None? Okay, thank you. Do we have our nominee? Ms. Baum, are you here by any chance? Okay, you are not. So we will.
She goes by Dr. Inoue.
I'm sorry?
She goes by Dr. Inoue.
Oh, Dr. Inoue. Okay, Dr. Inoue.
Yeah, my mother was one of her patients.
Oh.
I mean, and my sister, my wife was one of her patients. I think she recently retired.
That's a very good testimony, Senator. We will take that under advisement. No, good. Thank you for that information. Okay, we will move on. Members, the next item is for the Western Interstate Commission for Higher Education, or WICHE, as you probably know. President Lasner is stuck in traffic, so we will put him on the side for now until when he comes in, and we will continue on with item number 3, which is the Center for Nursing Advisory Board. And the mission for them includes providing accurate nursing workforce data for planning and disseminates nursing knowledge to support excellence in practice and leadership development, promotes a diverse workforce, and advocates for sound health policy to serve the changing healthcare needs of the people of Hawaii. So GM 648, submitting for consideration to the Center of Nursing Advisory Board gubernatorial nominee Gloria Fernandez for a term to expire 6/30/2026. And testifying is the Department of Health. And who do we have from the Department of Health?
Good afternoon, Chair Donna Mercado Kim and Vice Chair Senator Michelle Kidani and esteemed committee senators. My name is Glenn Wasserman, and I'm Chief of the Communicable Disease and Public Health Nursing Division of the Hawaii Department of Health. And I am representing Dr. Char, Director of Health, for this nomination. The department stands in very strong support of the nomination of Gloria Fernandez. And I'll summarize the Department of Health testimony. Gloria holds a doctorate in nursing, and Dr. Fernandez is a consummate professional who has held positions of increasing responsibility in the public health nursing branch over the past 20 years. She led the pandemic response for the Department of Health Public Health Nursing Branch, providing community outreach to underserved populations that were disproportionately affected by COVID-19. This improved the knowledge of COVID-19 countermeasures in the community, greatly increasing vaccination rates, and reversed the disproportionate percentage of infections and deaths in these communities. Dr. Fernandez is completely dedicated to nursing and community support with a track record of consistent success. She has exceptional skills as a nurse, educator, committee worker, manager, and leader. People look up to her for her knowledge, professionalism, and diplomacy, earning their trust and respect. She has a collaborative leadership style that ensures uniformity of effort and maximal efficiency. Dr. Fernandez's list of scholarships and awards is extensive, culminating in her induction into the UH School of Nursing Alumni Hall of Fame in 2018. The department highly recommends Dr. Gloria Fernandez as a member of the Center for Nursing Advisory Board and respectfully requests your confirmation for selection. Thank you for this opportunity to testify.
Thank you very much. Next testifying is Clementina Seria Ulip, UH in support, not here. Laura Richard, Hawaii State Center for Nursing and Support.
Good afternoon.
Laura, can you say your last name for me? I always have different.
My last name is Reichart, like ride like the bread cart, like
Okay,
shopping cart.
That's what I thought, and then I saw the CH and I thought, okay.
I joke that you just keep on adding consonants until you think you've had too many and you probably spell it right. Thank you so much for asking about my last name, but more importantly, asking for my testimony for Dr. Fernandez. I am hard pressed to say anything above and beyond what Dr. Wasserman provided, but I do want to emphasize everything he said and more. Gloria is a long-standing leader in nursing and very importantly, a public health nurse. And when we consider the future of our nursing workforce, looking at the fact that nurses are no longer majorly employed in acute care facilities, but instead they're in the community, we need to be advised by people who understand these settings and roles, who have a deep understanding of the communities that they are working in and serve, and can also help us learn how to recruit people into the nursing workforce that are more representative of the communities that they're from, as well as advance in their leadership. And Gloria fulfills all of these things in such a wonderful way. I know that she will be a strong contributor to the Hawaii State Center for Nursing Advisory Board. She already is a strong leader, and for us to have her voice established on our advisory board would be both an honor and a privilege.
Thank you, Laura. Next is Bryce Yamamoto, the Hawaii National Guard, in support. Holly Ann Kataoka, also in support. And we have 6 other individuals all in support. Anyone else wishing to testify on this nominee for confirmation? Hearing and seeing none. Gloria, are you here on Zoom?
Yes, I am.
There you are.
Chair. Yes, I am.
Would you like to make a statement?
You know, I want to thank you for first and foremost, Chair and Vice Chair and committee members for holding this hearing and accepting and hearing my nomination. I am humbled by the comments from Dr. Wasserman and Laura. I do hope to do the best that I can serving our communities and bringing a different voice to the Hawaii State Center for Nursing. So thank you very much for this opportunity.
Thank you. Members, any questions of our nominee? I have just a quick question. So part of this board is to recruit and to retain our nurses. Do you folks get involved at all with programs at the University of Hawaii for the nursing programs and where it's being offered?
From my personal perspective, from my personal interactions, I do, in a respect to that, I sit on one of the curriculum committees at the University of Hawaii. A portion of that discussion centers around how about nursing recruitment, and it does talk, and we do discuss, you know, some strategies for nursing recruitment without an actual assessment, meaning from my part. I do not want to go into, you know, any specifics because I'm just a part of a conversation, but I've not conducted, you know, an extensive or any type of assessment right now.
I'm just wondering at some point that the board would want to talk about where or if there should be more campuses that would offer the nursing program, like at West Oahu, or extension programs over at the community colleges. Because if you bring it to the community closer to where people live and working, that they have better chances of recruiting them to become part of the program. So I hope that's something that can be discussed in the future.
And I will say from a personal standpoint that if and when, I'm going to say when, not if, when West Oahu opens up a nursing program, I will be one of the first ones to seek employment and to help build program there.
Did you want to say something? Did you know that they had a program there and then they stopped it?
Yes, I was made aware of that. I do think it's beneficial because of its location. My catchment area when I first started in this particular position or public health nursing was from Waipahu back to Kaena Point. And so the marginalized and underserved populations are aplenty in those areas. And so, yeah, I knew that it started. There were discussions. I followed up and knew that it did not happen, but I'm hoping that those, and I do know that there is something now slated again. So I'm hoping that that actually becomes something, at least some type of planning stage, so that we can bring those types of curriculum and courses and grow from within that population to know best how to serve their own population.
Okay, appreciate that. Thank you. Members, any further questions?
No, just a comment, Chair.
Yes, Senator Kidani.
Gloria, I wanted to thank you for your willingness to serve on the Nursing Advisory Board, how important this is. And, you know, as you noted, and as we know, how important it is for the universities to continue their nursing programs, and especially when it's a well-used program, for them to continue it and not cut it from the curriculum. And on our side, you know, we try to do what we can to make sure that we do have the curriculum available so that we can continue to have good qualified nurses that we are all nationwide, you know, wanting to make sure that we do keep them trained. So thank you very much for your willingness to serve. Appreciate it.
Thank you, Vice Chair, for your comments. I appreciate it.
Thank you very much again also for your willingness to serve. Okay, members, we're going to go back to item number 2 because our nominee has arrived, and hopefully at a time to catch his breath for being stuck in traffic. I know how that gets. This is for the Western Interstate Commission for Higher Education, commonly known as WICHE. And WICHE serves 15 states, 2 territories in the West. As an interstate compact, WICHE partners with states, territories, and post-secondary institutions to share knowledge, create resources, develop innovative solutions that address some of our society's most pressing needs. The Commission has 3 primary responsibilities: fiduciary duty, including the oversight of organizations' finances, provides strategic direction for the organization through approval of WICHE's annual work plan, and select and evaluate the WICHE president. And having served on WICHE, I understand all of these things that needs to get done, and we try to come together every so quarterly, I believe it might be. So GM 589, submitting for consideration and confirmation to the Western Interstate Commission for Higher Education, gubernatorial nominee David Lasner for a term to expire 6/30/2026. Testifiers Demi Michelau from WICHE. She's here. Come on up. All the way, good excuse to come visit us in Hawaii.
Good afternoon, Madam Chair, Madam Vice Chair,
Good
members of the
afternoon and
committee.
aloha.
My name is Demi Michelau. I'm the president of the Western Interstate Commission for Higher Education, or WICHE, and I happen to be in Oahu for the Pacific Behavioral Health Coordinating Council meeting this week when I learned of this hearing. And I wanted to take this opportunity to say hello to all of you and offer my support for President Lasner's reappointment to the WICHE Commission, which is my board. So I know that you have my written testimony. I certainly won't read that to you, but I'm happy to answer any questions about WICHE if that would be helpful. I also want to express my appreciation for your service and Vice Chair Kidani's service to the WICHE Legislative Advisory Committee. And I hope that we'll be able to see you in person this fall in Sacramento. So with that, I will conclude my remarks and answer any questions.
Why don't you just sit there for now? Next testifier is Colleen Sather, if I say that correct, in support. And I don't believe that's here. Members, do we have any questions for Demi? No questions. Thank you very much for being
Thank you, Madam
here. I
Chair.
hope you enjoy your stay.
Thank you. It's wonderful to see you.
Okay. And now we do have our nominee who is here in person. President Lasner, if you want to come forward and make any statements, and then I'll see if there's any questions.
Thank you, Chair, Vice Chair, members. I have submitted a statement, which you have. I just wanted to appear because Demi was coming and to answer any questions you might have. This is a reappointment, so this would be my last term that I would be eligible for.
Okay. Members, any questions for President Lasner?
So how long is your
Kidani.
term?
It's 4 years.
And is this the second term you're serving, or?
Yes, I had a partial. I was appointed to fill somebody who resigned earlier.
See. And so when is the next meeting in Sacramento, you said?
So Sacramento is the Legislative Advisory Committee. The WICHE Commission is actually meeting in May. That will be the next meeting, but we meet telephonically as well.
I see.
That May meeting will be our first in-person meeting since the pandemic.
Oh, great. Thank you.
Okay, members, any other questions?
Yeah, just.
Yes, Senator Aguirre.
I guess with the, which is expanding now to the Pacific,
Mhm.
South Pacific, but I guess in terms of use of technology, since I think that's sort of your background, well, it is your background. How much is that going to change the way WICHE works? I mean, are you going to see a lot more people not even being resident of the campuses, of the WICHE campuses, or do you still think that there's still going to be a lot of undergraduates from Hawaii going to the WICHE campuses elsewhere?
So the membership in WICHE by the Pacific Territories doesn't directly change the technology options. That's, as you know, an area I've been working in for a while. What I think it will change is it will better connect the colleges in the US affiliated Pacific Islands. It will connect them to other institutions and practices in the West. And it also provides opportunities for students to attend universities in the region at discounted tuition rates. So it really avails them of the full suite of participation in WICHE through this membership that was brokered actually by Demi's predecessor. And she did the work to work with the US Department of Education to fund the participation of the rest of the US affiliated Pacific. Initially, we just had Northern Marianas, then Guam, and now we're able to bring in the rest this year.
Thank you.
Okay, members, any other questions? Oh, Senator Favela.
Just a couple of questions. Serving on this board and there's a lot more that you have on your plate as the president, chancellor, and the procurement chief officer. Having these positions and things that you need to do, you think you're going to be able to serve? We serve on this board at the capacity that you need to serve.
I do believe I can. It complements my ability to do my job, but it's also service to the region.
You don't think it's going to have any effect on anything, other positions that you have at the university serving on this board?
No, Senator.
Thank you, Chair.
Okay, you're welcome. Anyone else? Okay, thank
Thank
you.
you.
I forgot to ask if there's anyone on Zoom or anyone here in the room that wanted to testify on this measure. None? Okay, thank you. We'll move on. Okay, let's see, we are on item number 4, which is GM 649, also for consideration and confirmation to the Center of Nursing Advisory Board, a nominee Anne Scharnhorst for a term to expire 6/30/2025. First up again is Clementina Syria Ulep. Clementina in support. And I believe she's here, and Laura Reinhardt from the Hawaii State Center for Nursing and Support. Laura?
Good afternoon, Chair and Vice Chair, members of the committee. Anne Scharnhorst is a longstanding advisory board member of the Hawaii State Center for Nursing. This would be a reappointment and has been absolutely instrumental in ensuring that the Center for Nursing responded to the needs of neighbor island nurses in particular during the pandemic. Her ability to identify needs quickly and really before others identify them or articulate them to us was such a strength that enabled us to be responsive to students, to the workforce, and also to the other state departments as we worked with them to resolve problems that arose during the initial stages of the pandemic. She also has been a strong advocate for us uncovering, I say uncovering, but really it's more like highlighting the workforce issues and the education capacity on neighbor islands. And because of that, we've changed the way we report our nursing workforce research so that neighbor islands' needs and strengths are highlighted as their own. That's something we're very proud of and is work that Anne directly contributed to and influenced. influenced. She has so many other strengths. She represents education. She represents the community colleges, rural nursing, rural Hawaii, as well as Maui County. She is both a ready worker and a strong advisor, which makes us able to partner with her and develop programs and plans. And she brings other people in. And so we've been able to broaden our partnerships because of her engagement on the advisory board. She is an incredibly strong leader, and we would be very, very thrilled to have her continue on our advisory board with your recommendation or consideration and confirmation.
Thank you, Laura. That's all that I have signed up. Anyone else wishing to testify on this nominee at this point in time, in person or on Zoom? Hearing none. Let's see. Anne, are you on Zoom? There we go. Aloha.
Aloha.
Would you
Good
like
to
to?
be here, Chair and Vice Chair and members. I feel honored to be able and considered to serve in this role. I've been so proud to associate my name with the Hawaii State Center for Nursing. And I have been even lucky enough to go to a National Center for Nursing gathering, and Hawaii's center stands up among them. So the service to this state with respect to data and support and professional development is really, you know, a blessing that I don't know everyone realizes because we're used to it. So I'm very engaged in the looking down the barrel of a coming nursing shortage. And I see the faculty shortage as the bottleneck in addressing that nursing shortage. And we have trouble recruiting and even retaining faculty because we are significantly undercompensated compared to our colleagues here in Maui that's just 1 mile up the street in the hospital. So there are dozens of practicing RNs who have a heart and an ability to teach who really just can't afford to make the switch. You know, you have to leave tens of thousands of dollars on the table. So I'm really hopeful that there can be a discussion. I know money is tight everywhere, but to secure good qualified faculty and retain them does require a compensation that honors their expertise. And as we stabilize that, I think we can flex really effectively to meet the nursing workforce needs.
Okay, thank you. Certainly appreciate you continuing to serve. Members, any questions?
Yeah.
Yes, Senator Kitagawa.
Yeah, hi. I'm kind of interested in hearing what you had to say because I know that Maui Health Systems during the pandemic has had to bring in a lot of traveling nurses. And so they're very interested in expanding the capacity of UH Maui College to produce nurses. So has there been any discussion with them about allowing some of their people to be adjuncts or to do something that could perhaps help with the bottleneck? I know that they've been very interested in also, you know, an expansion of medical technician training and other things where they're so dependent right now on travelers.
Yeah, well, we enjoy a very good relationship with the hospital. If we're not sisters, we're at least cousins. So, and they are facing a shortage right now too of staff. So there's, you know, they're pressed on both sides. They see clearly the future need and how to address it. And in the short term, they're trying to take care of Maui County with a less number of staff that they have. So I think that we are committed one to another to use both of our resources together to meet that need to take care of Maui County. So I appreciate Maui Health and their collaborative spirit. And we certainly are collaborative with them. So I'm hopeful. I'm very hopeful.
Thank you.
Any other questions? I have a question, Anne. So in the salaries for the faculty, that's a collective bargaining item? Is that what the problem is, the collective bargaining?
Well, I think there's I'm sorry, I'm not so smart about, but I do know some organizational history, and the collective bargaining unit for faculty has wages. But some years ago, I've been here 15 years ago, so it was before I came, there was a special salary increase granted, and it was based upon a comparison of the staff nursing salaries and the faculty salaries. So nursing was given a raise. So the truth is, a brand new nursing faculty makes more than a brand new English faculty. Otherwise, we cannot recruit them. So now we are again, these 15 plus years later, at the same place again. We need to re-equilibrate the faculty salary with the practicing RN salary so that we can stay competitive and continue to produce. We need high quality faculty to produce high quality. So it's not just collective bargaining. We're asking for something above what the UPA provides.
Is this, I appreciate you bringing this up because it hasn't been brought up to me in the past or currently. Is this something that the center can also weigh in with the Board of Regents to raise this concern and whether or not they would then support this kind of
likely. I think the question is where the money will come from. So I think it's going to end up coming back to the legislature, although I would defer to Laura on that because she's the pro legislative gal, but I think there's a strong case that we could bring to Board of Regents, to UPA, but I think we end up coming back to you because it requires funding and a permanent source of funding. It can't just be 1 year, we're going to help you. So I think there's a bill right now about making more nursing lines and some funding to go with it. But I think you have to balance it as well with who we compete with to recruit.
Well, there's the tuition special fund, which I believe has $350 million been carrying over. And of course, the students do pay tuition. So I would think that there would be some funding in that or some ability to get funding in that, because I don't think we're talking about that much money for
It'd be
nursing
very
instructors.
strategic.
Okay. So we will look into that further.
Hello.
Thank you very much. Members, any other questions? If not, and thank you.
Thank you.
Okay. Our next is GM 650. And this is for the confirmation for Roberta Haley, also for the Center of Nursing Advisory Board for a term to expire 6/30/2024. Again, Clementina in support. And we have Laura again.
Good
Welcome.
afternoon again, Senator Kim. Thank you so much for having this very meaningful conversation, as well as hearing each individual nomination. I want to speak so highly of Dr. Roberta Haley. She is a relative recent person to come to our state, but she came and immediately introduced herself to the community and made strong working relationships. She comes with years of really incredible nursing education experience. And I think, as you heard from both Dr. Fernandez and Dr. Scharnhorst, the need to innovate around nursing education is one of our greatest needs in order to move our state forward and produce the number of needed nurses. Dr. Haley has an incredible mind and is very strategic in the way she moves forward in business and in education. And because of that, she has done very good things for Chaminade, but is also doing very good things for our state. I think that kind of creative thinking and knowing that she has tried and had successful activities, knows what works, what doesn't work, and is able to bring that innovation to our state almost through a new lens, is something that we critically need at this point in time. She will provide an additional value, which is representing our private schools of nursing. Most of our education is provided by the UH schools of nursing, but that different lens and that different angle that the private schools provide really will help us accommodate the needs of all nursing students in our state, as well as think about different business models, not just in education, but in nursing practice, being able to think strategically about partnerships, engagement, academic practice partnerships. So those relationships between healthcare facilities and schools and the profession overall are all strengths that Roberta Haley has and can contribute to our center.
Thank you, Laura. Also in support is Dr. Lance Askildson from the University, Chaminade University, Dr. Lynn Babington from the Chaminade University President in support, and Pamela Smith in support. Anyone else wishing to testify on this nominee in person or on Zoom? Hearing none. Is our nominee available on Zoom? Roberta, you there? There you are. Welcome.
Thank you very much. Good afternoon. And
Good afternoon.
thank you for the opportunity to be here at this committee meeting and for the opportunity to be considered for the Hawaii State Center for Nursing Board member position.
Did you want to say anything before we go into questions, if there's any?
I really appreciate the intentionality of this committee meeting. And I also wanted to say that one of the reasons I hope to be confirmed is I've been so impressed with the work of Laura Reichart and the center staff. They just do an incredible job. Over my career, I've been in many states and I haven't seen a stronger or more effective center for nursing. So I did want to note that. Thank you.
Thank you. Members, any questions? I have a quick question. In your response to our questions, under what do you hope to accomplish, you said to take on special projects. Do you want to elaborate what those special projects might be?
Well, I wouldn't presume to choose the special projects. What I was hoping is that if the director or the staff of the center or other members had a special project in mind, that I would have the background and the expertise to add value to that. I do have the bandwidth to work on special projects, and I think it's creative and fun, and a lot of good can come out of it. So I do appreciate a good challenge.
Okay, I'm sure Laura is listening intently and probably thinking of a number of projects that she can put you onto.
I hope so.
Hearing no other questions, again, thank you, Roberta, for your willingness to serve. Okay, we are on GM 651, and this is also for the Center for Nursing Advisory Board, gubernatorial nominee Linda Beechenor for a term to expire 6/30/26. Again, we have Clementina from the University of Hawaii in support and Laura, Hawaii State Center of Nursing in support. Thank you, Laura.
Good afternoon, Chair, Vice Chair, members of the committee. Thank you again for hearing another nomination. We're very happy to have this slate to present to you today. Dr. Beechenor is a very strong community organizer. Several years ago, over a decade ago, we lost our chapter for various reasons. That was connected to the American Nursing Association, and they have very high standards for maintaining a chapter. And recently, Linda used her network and her ability to convene and connect people and relaunched that effort. We now have an American Nursing Association chapter in our state. That was a huge undertaking. And now there is the professional, there's a chapter that is connected to our national professional organization, the American Nursing Association. I mention that because There is no other time than today in these times when we need to connect to working nurses. The center has been very successful at working with and through our schools of nursing and employers. But when you get down to the individual level, it is very difficult to communicate to 13,000 individuals. And somebody like Dr. Beechner has that strength and that ability. So her ability to connect and convene them will better enable us to communicate with them, but also to listen. And that is one of the things that I want to really emphasize in the coming years as we try to rebuild our nursing workforce, move away from a nursing shortage, strengthen our schools of nursing and our academic initiatives, as well as enable our nurses to be strong and healthy in their careers, in their personal lives, and also in their patient care strategies and roles. But we need to be able to listen and hear from them. I think you've mentioned earlier in this hearing your interest in that as well. And I just want to recognize that with this nomination, I think that we will be closer to that goal.
Thank you. Anyone else wishing to testify on this nominee on Zoom or in person? Hearing none, we do have our nominee here. I'd like to call her up, Linda. Welcome, Linda. Thank you for being here in person.
Senator Mercado Kim, Vice Chair Kidani, and members of the committee, I'm very honored to be considered to be appointed to the advisory board for the Center for Nursing. I've provided you with a lot of information about my background, and I've been involved in the politics of nursing in Hawaii since 1984 when I arrived here. And I would like to continue my work, and especially with the Center for Nursing that is responsible for the workforce of development for nursing in this state. I wanted to be here today so that you could ask me any questions that you had, because I think this is such a critical time for us in Hawaii to address the long-standing issues that we've had with providing a strong nursing workforce for the people of Hawaii to receive quality care. And so that's why I'm here. And I would like to hear any questions that you might have.
Thank you so much. Members, any questions for Linda? I have a couple. So Linda, you heard earlier when I asked Gloria Fernandez regarding our nursing programs and how we can better, because without the programs, it's very difficult to get the students to the position to become nurses. So do you think that that being on the board, it's something that you folks will get a little bit more involved in? I liked your statement where you said, I am a careful meddler in areas that I believe need addressing, especially if they are ineffectively addressed by the stakeholders. I need to learn how to be a little bit more careful in my meddling. But you say that, and so you know, I certainly would think that the center could get involved more.
Most definitely. And as far as the question of nursing education in the state, it is not a matter of recruiting students into the programs. We have waiting lists for student nurses to come in. We don't have the faculty to teach them. We have problems with finding clinical sites for the faculty to work with the students in the areas where they need that kind of practicum, hours and hours and hours of it. It's a very expensive and labor-intensive education process that we've been falling behind on for decades, in that we don't have a strong faculty. And Dr. Scharnhorst, I believe, talked about the problems with recruiting and retaining faculty for nursing, people to teach. When I'm going to address a position that often comes up for faculty. I'm looking at accepting a salary that is below what a new graduate nurse could make at any hospital. That's ridiculous to expect me, as with my doctorate in nursing practice, to take that kind of a hit financially. And then there's the clinical sites that are an issue. And I would hope that, and I know the center already works very closely with the Healthcare Association and does a lot of work for placing students. And we need to strengthen that program too.
I wonder how the law school does it, because I know that the law professors don't make as much as the attorneys in private practice. So I wonder how that, can translate to the nursing program as well.
Sometimes there are shared positions between clinical and academic sites. But someone mentioned adjunct faculty sharing from the hospitals before. But again, to go into an adjunct position from a staff nurse position even, and you'd have to have an advanced degree even to teach, would still be a huge financial loss.
Well, I'd like for the members of the nursing board to maybe get together with the president, who happens to be here today, and maybe find out how we can do that, how we can get creative in getting more faculty to be able to teach, and how do we compensate them.
Thank you.
Members, any other questions?
Yes,
Yes, Senator Favela.
That kind of made me rethink. So we don't have enough people to teach the classes, and then we very much lack on facilities to have these. Thank you for letting us know, because we're thinking, it's the university's fault that we don't have enough. No, I mean, we're always harping on you, right, President Asner, about certain things, but if we don't have enough facilities, we gotta make sure we get some facilities for these kids to, no sense we put them in there if they ain't got nothing to be able to do the work. But thank you for letting us know, or letting me know. I'm pretty sure they
Very
knew
well.
yesterday.
Thank you.
Senator Kidon.
Yeah, I'm sorry, I had to go and vote in another hearing. So I missed some of your testimony, but could you clarify for me who pays your salary?
Who pays
Yeah, your
as what?
as what is the GM for?
Oh, this is for the nursing center for
The advisory
nursing
board?
advice, Yeah.
Yeah, so there's
nursing
no
advisory
salary
board.
for
No,
them.
no, they're volunteers
Okay, but
Yes.
what about you just talked about some salary.
for the nurse, the faculty to teach.
Yeah,
the
teaching
students.
faculty, so
Right.
they're paid by the university.
Yes,
Okay, and you're
Yes.
saying that there's not a lack of students, there are a long list of students, but not enough positions to fit them
Exactly.
in. When did we start having a list of a backlog of students wanting to be, in the curriculum, the nursing program, but not enough spaces and faculty to teach? Do you know?
my personal impression is that that's been ongoing for decades.
Hmm.
And it has resulted in the development of the private schools that have nursing programs. And they have kept up with retention, with absorbing lots of students.
And how many programs does the university have throughout the state?
The University of Hawaii.
Correct.
There are 2 on the Big Island, 1 on Maui, 1 on Kauai, and Kapiolani College, UH,
Leeward.
Nancy Atlas Para-Welch School, and am I leaving someone out?
So
Consider.
almost every
Hawaii.
university and some of the community colleges have programs.
Yes,
Only KCC
Who-
and.
who educate registered nurses
Correct.
or to become registered nurses.
And we did have one at UH West Oahu, which was discontinued about 4 years ago, although there was a demand for it.
Mhm.
And that was in affiliation with the UH Healer program. And we've asked for that to be reinstated. I don't know whether that's going to happen or not.
And again, they're going to run up against the wall of not having the faculty to
Does,
teach.
does JABSOM have a nursing program? John A. Byrne School of Medicine? Or is that only for doctors?
Physicians.
Only for
Physicians.
physicians, not nurses?
It's a separate school. Yes.
Okay, thank you.
Well, you know, what was interesting is yesterday we had a resolution that talked about, oh, there was a day before, adding the nursing program back to West Oahu. And the person from West Oahu, the chancellor, wasn't available. Not sure where she was, but said that they stopped it because they couldn't duplicate. The regions have a policy not to duplicate. But never once did he mention they didn't have faculty to teach, right? So that's why we're asking this, because that's never been brought to our attention. You know, that's one of the reasons. And, you know, duplication, yes, but if there's a need, which he did say there was a need on the west side for it. Again, that's something that the president or the board of regents need to address, so we can resolve this. One more question. So the salaries at the private universities for faculty that in teaching nursing, is that they get paid a lot more?
I'm sorry, at which schools?
In the private, because you mentioned
No.
the private colleges have programs and they absorbing a lot of the students, and so they seem to be able to retain their faculty to teach. So I'm wondering if they get paid a lot more than our nursing faculty.
At UH, they certainly have more flexibility, and of course they charge, the tuition is much higher in private universities too, to support the programs. But if you look at the vacancy rates in the UH nursing programs, it's very difficult to fill a
So
vacancy.
perhaps the center, this advisory board can look and compare what those salaries are for the private universities, Chaminade and Hawaii Pacific and so forth, if they have it. And
In my experience, some of the private schools pay less or equivalent, and some are better.
okay, well, that'll be good to get some kind of
Yeah.
a survey of a list. Well, thank you. That's been very helpful.
Thank you.
Thank you, Linda. Okay. We are on our next group of nominees. This is for the Hawaii Commission for National and Community Service. Their mission is to identify, foster, and create opportunities to promote volunteerism throughout our state. And you see our commission on Center for Nursing is all volunteerism. Commission works closely with the Nationwide Corporation for National and Community Service, the CNCS, and is the liaison between CNCS and the state of Hawaii. Hawaii Commission is the only way for Hawaii to receive federal funds dispersed by the CNCS. And so our first person that GM 373 for consideration to the Hawaii Commission for National Community Service is gubernatorial nominee Karen Mukai for a term to expire 6/30/2024. We don't have anyone signed up to testify, no testimony, and Ms. Mukai was on Zoom but had to leave. So members, we don't have anyone to ask questions of. I personally know Ms. Mukai, and she does volunteer for numerous things within the community, so if that says anything. Okay, moving on to GM 738 and 739. submitting for consideration and confirmation to the Commission for National and Community Service, gubernatorial nominee Ann Nakakura for a term to expire 6/30/2022 and 6/30/2025. So she'll be serving two ending of one term and then a new term. And we do have Ernie Martin, individual, in support. Don't believe is here to testify. And Anne, you're available. Would you like to have opening statement? Welcome.
Good afternoon.
Afternoon.
Thank you very much for your time and consideration. I just recently, after recently hearing about the commission and its purpose, I was really excited to apply for this opportunity to serve on the commission. I really, at our school here at La Pietra Hawaii School for Girls, my current employer, one of our core values is kahiao, and that is selfless giving and generosity of spirit without the expectation of return or reward. And I strongly believe that this core value encompasses the purpose, mission, and guiding principles of the commission. So I just wanted to share that I have always wanted to volunteer and embrace the spirit of kahiao. And I believe this opportunity would align with this, knowing that I'm investing my time and utilizing my strengths and experience to help support the people of our island and state. Thank you very much.
Thank you, Anne. I have a quick question. How did you find out about this commission?
Oh, a good friend of mine, Joy Kono, who is the current chairperson of the commission, asked if I would be interested in serving. I think she asked based on my experience in accounting and financial background. So.
No, but I asked that because I wasn't aware of this commission before I took over this committee, and then was kind of introduced to it. So I know not many people are aware. I didn't know we had a commission that basically is for volunteerism and community service. So thank you. Appreciate your willingness to serve. Members, any questions for Anne? Hearing none. Anne, thank you again.
Thank you very much.
Our next governor's message is for Diane Peter Nguyen, and for a term to expire 6/30/2022 and 6/30/2025, also for the Commission for National and Community Service. We have Naomi Khan in support. I don't believe Naomi is with us, but we do have Diane. How are you, Diane? Welcome.
I'm good. Chair Kim and members of the Senate Committee on Higher Ed, aloha and mahalo for allowing me to testify today. I'm so honored to be nominated to the Hawaii Commission for National and Community Service. In my current role as CEO as the Pacific Islands region of the American Red Cross, I have seen firsthand the power of volunteers. And in fact, about over 90% of our work is done by volunteers. So being a part of this commission will help me focus on promoting volunteerism through our AmeriCorps state and national program. As you know, Hawaii's remote location means that rural communities, whether Hana, Hauula, Hanalei, or Hawi, are going to be cut off during disasters. So the volunteers and emergency resources that they have right there on hand are what they have. Training up volunteers in these areas is critical for disaster readiness. As a Native Hawaiian, the values, as the last nominee mentioned, part of the commission's goals, Kokua, Laulima, and Lokahi, speak to me very personally. So I have about over 25 years experience leading Hawaii organizations, both nonprofit and for-profit, as well as decades of experience on various government commissions, such as the Planning Commission and most recently, the City and County Salary Commission. I did have parents who valued community service and volunteerism in their daily lives. So this is a value that I very, very much want to share with the larger community. In closing, mahalo, Senator Kim, and members of the Higher Ed Senate Committee for your consideration today.
Thank you, Diane. For as long as I've known you, you've always volunteered for something. So we certainly appreciate your volunteerism, and it's good to see you. Members, any questions for Ms. Peters-Nguyen? Hearing none. Diane, thank you again. Aloha. And finally, we keep the best for last. We have GM 742 and 743. And again, this is for the Hawaii Commission for National and Community Service, gubernatorial nominee Frank Haas, to a term to expire 6/30/2022 and 6/30/2025. Testifying, let's see, Kirsten Faulkner, Historic Foundation of Hawaii in support, Neil Yokota, Stryker Weiner in Yokota in support, Jessica Rich. Jessica, how are you? If you want to come up and speak in support of our nominee.
Aloha and good afternoon, Chair Kim, Vice Chair Michelle Kadani, and members of the committee, Senator Bukai, Senator Garin, and Senator Kurt Vervella. It is with my great honor that I support the nomination of Frank Haas to serve on the Hawaii Commission for National and Community Service. My name is Jessica Lonnie Rich, and I'm the president and CEO of VASH, Visitor Aloha Society of Hawaii. It's a nonprofit organization that helps tourists in crisis. I'm also a television producer for a show called Inspire You and Me on K5. I have known Frank Haas for over 30 years. Frank has a long list of professional accomplishments, including his important work when he was the vice chair of tourism marketing for the Hawaii Tourism Authority. And he is currently the president and CEO of Marketing Management, Inc. Frank has extensive community service experience, including serving on many board of directors for many nonprofit agencies, to name just a few: Hawaii Public Radio, Pearl Harbor Aviation Museum, Hawaii Historic Foundation, and also VASH, Visitor Aloha Society of Hawaii. In closing, Frank is hardworking, he's reliable, he's extremely diplomatic. And I know that because on boards, sometimes we have a lot of differences of opinion. He is a generous professional who goes above and beyond to be a strong proponent of community service. From someone who has known Frank Haas for a very long time, I kindly ask the Senate committee to please support the nomination of Frank Haas to serve on the Hawaii Commission for National and Community Service. Aloha and mahalo.
Thank you, Jessica. We also have 25 individuals also send in testimony in support. I don't believe any of them are here, but if you are, or anyone else wishing to testify on this measure, if you would like to come forth, hearing or seeing none, we'll have Mr. Haas. Good to see you again.
Aloha, Chair, Vice Chair, members. Thank you. My name is Frank Haas, and I'm very honored and humbled to be nominated to this commission. As Jessica said, I have been involved in public service in my entire career. I've provided you with my resume and answers to your questions, and that summarizes some of the nonprofits I've worked for or worked with. Let me just summarize some of the reasons why I'm excited about the prospect of working with this commission. First of all, I have seen the great good that nonprofits do in Hawaii. And I appreciate the untapped potential that they have that could be released with the involvement of volunteers, more volunteers. So I see a huge benefit in what this commission does. Secondly, I see the benefit for individuals. A lot of students who have a very fine education coming out of UH and other programs simply don't have soft skills, working backgrounds that prepare them for the workplace. So volunteer positions can help do that. And third, companies are looking for that level of experience beyond the educational credentials. I just completed a project for the Hawaii Workforce Funders Collaborative, and we interviewed more than 60 CEOs, and that was a common theme, that people are coming to them with good credentials, but really unprepared for the workforce. When I ran a small company, we had 35 employees. It's very difficult to hire an employee if you don't have a proven track record, and some volunteer service can provide that. So for all those reasons, for the benefits that come out of the good work of our nonprofits, for the benefits that come to the people that volunteer, and for our business community, I think that AmeriCorps is a wonderful opportunity, and I'd be delighted and honored to serve on this commission.
Thank you very much, Frank. Members, any questions for Mr. Haas? I just want to say I met Mr. Haas while he was at HTA when I was tourism chair. And so I got to see his good work there. And I appreciate that you continue to volunteer and be involved in the community. So thank you for your work. Members, if not, thank you. Okay, I don't believe we need to go into recess. I'm ready to make my recommendations. And so starting off with, and if you have the vote sheets, I do. You do? Okay, very good. So starting off with the first nomination to the Hawaii Medical Education Council, recommendation is to advise and consent for GM 588 for Colleen Inoue-Baum, Dr. Inoue, as she was called. Members, any discussion? Hearing none, chair votes aye.
For GM 588, Chair votes aye on advising consent. Vice Chair votes aye. Senator Keith Alderon.
Yes.
Senator Wakai.
Yes.
Senator Favela.
Yes.
Measures adopted.
Thank you. And for the Western Interstate Commission for Higher Education, for GM 589, for the nomination of David Lasner for a term to expire 6/30/2026. The recommendation is to advise and consent. Is there any discussion, members? Hearing no discussion, chair votes aye.
With 5 members present, are there any objections? Are there any reservations? Measures adopted, Madam.
Thank you. And for the Center for Nursing Advisory Board, I am going to take all the advising one vote if there's no objection. So if this is for GM 648 for Gloria Fernandez, GM 649 for Ann Skarnhorst, GM 650 Roberta Haley, and GM 651 for Linda Beechnor. That's GM 651. So for all of those, I am recommending advise and consent. Members, is there any discussion on each of the GMs? Hearing no discussion, Vice Chair, the chair votes aye.
With 5 members present, are there any objections? Are there any reservations? Measures are adopted, Madam Chair.
Thank you. And finally, for the Hawaii Commission for National and Community Service, we have GM 737 for Karen Mukai, GM 738 and 739 for Ann Nakakura, GM 740, 741 for Diane Peters Nugent, and for GM 742 and 743 for Frank Haas. Recommendation is to advise and consent on all nominees that I read. Is there any discussion? If not, chair votes aye.
5 members present, are there any objections? Are there any reservations? If not, measures are adopted, Madam Chair.
Thank you. I want to congratulate and thank all of the nominees today. This items will go onto the floor of the Senate. I'm not sure when, maybe in about a week or so, for a full confirmation. So till then, thank you again. We are adjourned.